When we look at health right now, we are in a massive battle, and a lot of people don't realize it, right? When we had COVID, everybody was so focused on what was going on, what we were facing, and what we could do for that next step. And we've had focuses over the last, 30, 40 years, focusing on eliminating cancer, focusing on, eliminating, Alzheimer's and some of these other things. And what do we have to show for those things? Nothing. We have so many chronic diseases. Our healthcare system is spending massive, massive, massive amounts of dollars. We are losing the war. And that's what we're going to dive into, is what you need to be aware of and how you can actually turn your health around, take care of your personal health and your personal wealth, because they are tied together in this. I'm Dr. Jeff Cumro, and over the past 15 years, I've been blessed to work with over 5,000 patients. And through that, there are a lot of patterns that emerge, right? And I see a lot of people that come in and they're taking piles and piles of medication. And the medication, you can ask them what they're for, and some people don't even know what those medications are for. Some people are taking 3 or 4 medications for the same exact condition. So it's something that it gets out of hand relatively quickly on some of this. And the sad thing is, we don't know what the interactions are. Once we start mixing those drugs, we don't have any studies that will tell us what the interactions are. So when we have one drug, we know that that one drug likely has these side effects. But when we have 2 drugs together, we have no idea how people are going to react, what kind of side effects they may have, what kind of problems they may run into, how those drugs are going to interact and work against each other, for each other, different things like that. There's no research on any of that stuff, which is scary. But that's a tangent. We're not going to dive into that right at the moment. So the first thing that we have to be aware of is we are in the middle of a chronic health pandemic. There are so many people out there that are fighting this. 80% of chronic diseases are lifestyle in nature, and I think the most recent stat is about 70 to 80% of people have a chronic disease. It depends on what kind of which research you look at on this, but 70 to 80% of people have a chronic health condition. 25% of people have 4 or more chronic health conditions. And this is another thing that we're going to dive into here in a moment. But what we see on this is our current healthcare spending. And I broke out the whiteboard for this because it is important to see this. Okay? So 4.9 trillion dollars a year. So what does that look like? That's what that looks like. $4.9 trillion. So, I mean, if we were going to make it exact on this, we go 4.9, right? So that much money is being spent every single year in the US on healthcare. Now, 70 to 80% of people still have a chronic health condition. Can you guess how much of that $4.9 trillion is being spent on the care for those chronic health conditions? 90%. So we are being told right now, and if we look back here just a little, we had the government shutdown, and a lot of that was over healthcare, is over spending, all of these other things. And we look at this right here. Almost all chronic diseases are avoidable. They say 80%. The number is likely higher than that, but it's difficult to prove because, there's a lot of different lifestyle factors. Smoking, what your diet looks like, what your sleep looks like, what your hydration looks like, how much you exercise. There's a bunch of factors that go into this. I mean, you could count stress in this too, right? So it's very, very easy to make an argument that 100% of our chronic diseases are chronic healthcare can be eliminated by lifestyle changes. And we know that there is no way that you can eliminate those chronic health, issues with a drug, right? Because what leads to them? If lifestyle leads to that, can you eliminate exercise with a drug? Can you replicate it? We can't do it, right? Can you replace a healthy diet with a drug? We can't do it. We don't have that, right? Can you reduce stress with a drug? No, by definition, a drug is actually going to put more stress on your system because it decreases your ability to self-regulate. It is changing a system in your body that changes how you regulate yourself. Can you Can you, I mean, you could keep going on. Can you improve sleep? No, we know that you can get more sleep, but it doesn't improve your sleep. Big difference between the two. Can we improve metabolism? No, we don't improve it. There's so many things that we can look at in this, and it just doesn't work. So the only way to do this is through lifestyle changes, changing our diet, exercising, improving our sleep quality, improving our stress management, making sure we're hydrated, making sure we're not smoking, making sure we're not being exposed to some of these other chemicals. There's a lot of different ways of going about this, but we've got to get back to those fundamental things, right? So we're looking at these numbers right here, and we're saying this right here is going to bankrupt all of us. How does that affect every single person in the US? A lot of people are saying, if the government goes bankrupt, the government goes bankrupt. We just need to tax the really rich people. It affects everybody. Because as soon as we start to have problems with that, what do you think is going to happen to taxes? Tax rates are going to go up. What's happening with insurance rates? Everybody, well, really, you could put like 3 arrows on this one because the speed that they're going up is astronomical. It's the single biggest cost of any business. And this goes on and on and on. The costs get passed on to every single one of us. But there's only one person that can affect any of this, right? Nobody can eat for you. Nobody can exercise for you. Nobody can diminish your stress. Yes, they can help. They can guide you. And having a guide on that is very, very important. Not only because, so there's different layers on this, right? Not only is it important because somebody else can give you a shortcut to it, right? Through 5,000 patients, I've found some ways that it's easier to see, hey, this is the spot that this person is struggling. This is the spot that they're most likely to struggle. This is where they need the support. This is the thing that's going to help them get there. But having them on task, having them know what step to take when, what pitfalls to avoid, if things aren't working right or they're getting frustrated, because there is going to be frustration in any kind of change like this, right? Any process where we're learning and growing, there's going to be frustration. So having a guide, having a mentor that knows how to do this is super, super important. And this is what chiropractic has been since the very beginning. I listened to a speech from, it was an old one, like the 1960s. Yes, I am a nerd. But I was listening to an old chiropractor speak in the 1960s, and they were talking about the first chiropractic clinic. And I believe chiropractic started in 1895, and I don't think that the clinic started right away, but it started not long after that. And what they were doing is they bought a big house in Davenport, Iowa, and they would bring in patients, and they would live there for a period of time. Why? Because they could help control what they ate. They could help control how much exercise they got. They could get them outside into the sunlight. They had community there. Everybody was working together for the same goal. Everybody was there to get healthy, right? So we have all of these lifestyle things that are working together to get that next step. And that's where all of this comes together, is having that community, having all of the pieces that we need to fit together. But I can make you 2 promises. If you continue to go down the path that you've already been doing, you're going to get similar results, right? Just by definition, if we don't make changes, you're going to get similar results. Where do most people go with this? The reason that 25% of people have 4 or more chronic diseases is as soon as you get one and you continue down this path that you've been told you're stuck with it, you can't do anything with it, get used to it. I've been told all of those things with my autoimmune thyroid, right? I haven't taken medication in 10 years. I haven't had any problems with my thyroid in 10 years. But I was told all of those things when it all started. It took me a few years to find the answers to it. But there are answers out there if you're willing to look for them, if you're willing to work for them. But they don't want you to know that because they want a lifelong patient, right? So we've got to work to improve these lifestyle factors. And if we don't do that, that's where we move into a second chronic disease, a third chronic disease, a fourth chronic disease. And as these start piling on, it gets more and more and more expensive. Now, the average person with a chronic disease, we're looking at 45 to 90 days of missed work. And that might not be missed work like I didn't make it into work, but it's I wasn't productive at work. So absenteeism and presenteeism, being there and not being productive, 45 to 90 days of lost productivity. Now, you might say, I'm an employee, that doesn't really matter that much. But it does matter. And it's not just in you going and being productive for the business. Just think, if you are losing this many days in the office, how many days are you losing at home? What is the number one complaint that I hear? I don't have time for that. Like, where am I supposed to fit that in? I've got all these other things that I've got going on. But if we can improve focus, if we can improve efficiency, if we can improve outcomes and gain some of these 45 to 90 days back where you can be more productive on those days at home, where you can be more present with your kids, where you can be more present in the tasks that have to be done, how much time would that save you? How much further ahead would you be? And that's not just ahead in the tasks at home. That's ahead in health. That's ahead in the relationships that go with this, right? Your friends, your family, everybody else that goes with this. Everything in life starts to improve as we start to improve our health. So while we have been in a massive, massive battle, and we haven't seen progress in this, right? We don't see, like, the war against cancer hasn't done anything. The war against drugs hasn't done anything. All of those things have continued to get worse. The war against Alzheimer's and diabetes and you name it, none of it has made any difference. All it's done is cost us more and more money. When we make this shift and we start looking at what we can do from a lifestyle perspective, living the chiropractic lifestyle of, better movement, which is what chiropractic is, right? We're finding areas that are not moving correctly and we're getting them to move better. Better diet, better sleep, and better overall stress management. We start to see all of this shift in the way that we need it to shift to actually make a difference. Not just for us, not just for our state, for our entire world, because we are not the only ones that are fighting this anymore. We got Canada, we got Australia. So many nations are fighting the same battle right now, and it continues to get worse and worse. And we've got to shift the focus. So, as always, I love and appreciate that you guys spend your attention with me. I know that that's your greatest asset, and I don't take that for granted. I really, really appreciate you doing that. If you have questions, reach out to me. I'm happy to help how I can, and I will catch you on next week's video.